My name is Denise A. Yardley. I'm a senior investigator at the Sarah Cannon Research Institute. When we look at the women now that have been touched by a diagnosis of breast cancer, we're looking at now well over 3 million women, and they're in various stages. Many of these have undergone surgery and early stage breast cancer therapies, and then there's a group of patients that are surviving with the disease, and I think we're seeing that the patients with advanced breast cancer surviving longer as a reflection, I think, of improved therapies. I think we've moved very much away from some of our chemotherapies and have very focused, novel, targeted agents or biologic agents, so that these patients who unfortunately have experienced perhaps recurrent disease or walked in with advanced disease now are having great survival and living with their disease, where almost we become what we call for breast cancer a chronic disease, because our therapies keep these patients functioning in their day-to-day environments. Sometimes the disease gets out of check and we have to change the therapies, and I think that's very much like many diseases. When we look at diabetes or we look at heart disease, sometimes the diseases require a little bit more therapy and intervention, but patients are continuing to have an excellent quality of life and functioning with their disease. And I think that's been probably the greatest shift when one thinks about now a patient that's battling a diagnosis of advanced breast cancer. It's very different than in the past, and I certainly know many patients know someone who's had a remote diagnosis or a family member, and the treatments 20 years ago are so far and vastly different from the therapies that we offer these patients these days that you can't tell often when you're out of the clinic who has a diagnosis of advanced breast cancer and who does not, because these patients aren't bearing, I think, the real telltale signs of a patient who's well under therapy with chemotherapy, with the developments of new drugs with different side effect profiles, and even now some of the novel biologic agents. So we're really learning to embrace and live with breast cancer in the patients that now have advanced disease.